Mhm. Hi. So we have logged in. I should wait. So today's topic is fairly ambiguous. We can see that because ये बात सच है कि हमारी स्पेशलिटी में और हमारे अराउंड इस टॉपिक और इस सब्जेक्ट पे बहुत कम अंडरस्टैंडिंग है. So that is why we really wanted to give some time and attention to this topic, orofacial pain in fibromyalgia patients. So what is it? फाइब्रोमाइल्जिया के ऊपर बहुत सारी चीज़ें हो रही हैं, बहुत सारे इवेंट्स हो रहे हैं अभी इस महीने भर, ताकि लोगों को समझ में आ सके. फाइब्रोमाइल्जिया इज diagnosed, managed and treated by rheumatologists, people who are responsible for treating autoimmune problem. तो शुरुआत तो यहीं से होती है कि उसकी एम्बिग्यूटी इतनी होती है कि उसको ट्रीटमेंट कौन करता है. इट इज ट्रीटेड बाय rheumatologists. लेकिन अब इसमें ओरोफेशियल पेन का क्या रोल है? विल कम टू दैट. फाइब्रोमाइल्जिया एक क्रॉनिक पेन सिंड्रोम है. पेन में बहुत तरह की प्रॉब्लम्स होती हैं, बहुत अलग तरह के सिंड्रोम्स होते हैं और वो बहुत अलग अलग तरह से मेंटेन्ड होते हैं. पेन का जो मैनेजमेंट होता है वो मैकेनिज्म बेस्ड होता है. तो जब हम पेशेंट से बात करते हैं, हमें हिस्ट्री को बैकवर्ड्स जाके कनेक्ट करना पड़ता है, समझना पड़ता है कि उनकी प्रॉब्लम है क्या, और फिर उनका ट्रीटमेंट प्लान अकॉर्डिंगली डिजाइन करना पड़ता है. सो फाइब्रोमाइल्जिया इज बेसिकली अ क्रॉनिक पेन सिंड्रोम, and in this problem there is a widespread musculoskeletal pain that patients will be experiencing. There is tenderness, there is stiffness, there is a lot of fatigue, and these symptoms obviously take away the quality of life and induce a lot of suffering in patients who are suffering with this. About 4% of men have fibromyalgia pain and 10% of females. Now obviously the statistics that I'm talking are from the developed world. हमारे कंट्री में epidemiological research and the presenting symptoms, इन सब चीज़ों पे अभी काम करने की हमें बहुत ज़्यादा ज़रूरत है. Being practicing in India for 6 years now, I have seen that pain presentation in our population is different from how it used to present when I was in US. तो पेन का presentation is different in our population. हमें ज़रूरत है कि हम अपने लोगों पे, अपने यहाँ पे थोड़ा और evidence based research करें इस topic पे, so that we can understand it better. Today we have tried to compile few common things. कि fibromyalgia का diagnosis used to be on tender points and it has changed now. Why has it changed? It has changed for very many different reasons, but one of them being कि it was considered कि it is only females suffering from fibromyalgia because they have more sensitivity. उनकी sensitivity to pressure pain is more. So fibromyalgia pain में जब हम pressure देते हैं तो patients को pain ज़्यादा होता है as compared to a healthy person. So the tolerance or the pain threshold for pressure stimulus is very, very low and minimal in fibromyalgia patients. And when the research work around this subject started working, या fibromyalgia का diagnosis just दुनिया में establish होने लगा था, उस time पे this was like the most important criteria, one of the most important criterias for the diagnosis of fibromyalgia. As research evolved and we had more and more evidence for the management of these kind of problems, we got to understand that there are other aspects also to this problem and men also suffer from this problem. So then there are diagnostic criteria which are established differently, and like I said, rheumatologists are the right people who diagnose and manage this problem. The pain type of fibromyalgia is called as nocioplastic pain, which is its own type of pain. So I'll not get into too many technicalities of that, लेकिन ये पेन जो होता है, इस पेन में autoimmune systems, the autonomous nervous system का रोल काफ़ी बढ़ जाता है. तो इसका मतलब ये होता है फ्रॉम मैनेजमेंट पॉइंट ऑफ व्यू कि हमें उस पेशेंट की हर पेशेंट को डायनामिकली समझ के एक यूनिक ट्रीटमेंट प्लान उनके लिए बनाना पड़ता है. सो then we come to the next important fact that fibromyalgia coexists with a lot of other autoimmune problems. So it is established that if somebody has rheumatoid arthritis, then about 6% of these patients in the first year will have fibromyalgia pain, and over 3 years the percentage of patients who will have fibromyalgia pain will go up to 25%. So it becomes, but these patients are on treatment for their autoimmune problem, they are on treatment for their rheumatism. तो जो एक सेकेंडरी प्रॉब्लम के जैसे शुरू हुआ था, क्योंकि प्राइमरी प्रॉब्लम तो rheumatoid arthritis था, it started as a secondary problem, but the treatment with immunomodulators and all of those things for rheumatoid will manage that condition very well. But over 3 years, this pain now becomes the primary pain. And this is where the real challenge happens. In patients को जब हम देखते हैं हमारी day to day life में, they are extremely frustrated because they have been through multiple therapies and they have healed from their primary problem, but still they have so much of pain which is making them dysfunctional. Okay, this is the nocioplastic pain, which is understood and managed appropriately there. The management of fibromyalgia is around education, behavior modification of the patients, and also what we call as exercise therapy. Although we are very careful to use the word exercise with the fibromyalgia patients. जो इंसान अपनी day to day life की activities नहीं pull करता, उसको अगर हम कहेंगे कि प्लीज एक्सरसाइज, इट्स फ्राइटनिंग फॉर देम. इट इज रियली फ्राइटनिंग फॉर देम. सो वी हैव टू बी वेरी केयरफुल, एंड आई एम सेइंग दिस बिकॉज ऑब्वियसली जो भी आज लाइफ है, somewhere or the other, their friends, their family, or they themselves would have seen this pain closely. That is why you are here. So please help these patients who are suffering to इंक्लूड एक्टिविटी. हम जब पेशेंट्स को बोलते हैं तो हम एक्सरसाइज नहीं बोलते, हम बोलते हैं प्लीज इंक्रीज एक्टिविटी इन योर लाइफ. एक्टिविटीज लाइक गेट अप फ्रॉम द चेयर एंड वॉक इन योर कॉरिडोर. Okay, that's movement, and when you are doing that movement, please just rotate your shoulders or move. Movement is life. Human body is made for movement. So encourage them. Just make them twist, put a song and 2 steps, and that's it. Bring activity slowly and gradually back into their life. Now when we talk about this is in general about fibromyalgia as a condition, and then the other aspect that comes up is that is diet a part of fibromyalgia management? We don't know. Scientific or evidence-based, I cannot say. We need more research. We need more concrete data to talk about it. But what we have is integrative pain management center. And what does the main pain integrative means? Integrative means जहाँ पे बहुत सारी different therapies एक साथ patient के pain को कम करने के लिए काम करते हैं. There may be medicines, there may be certain therapies, there is yoga, there is music, there is art, there is counseling, there is physiotherapy. हर चीज़ एक इंसान के लिए डिज़ाइन ऐसे की जाती है जिसमें उसके पेन से उसे राहत मिल सके. So when we want to talk about things like that, this is called as integrative therapy. And in the Western world also today, this is how things are spoken about. Initially, when I was a student, we used to say Ayurveda is a complementary medicine system. Acupuncture is like the alternative therapy of approach. But today what we are talking is integrative approach, जहाँ पे हम इन सारी चीज़ों को मैनेज करके लाते हैं. तो डाइट उसमें एक बहुत सिग्निफिकेंट रोल प्ले करता है. हमने ये देखा है कि जो लोग ओबीज होते हैं, दे आर फेटीग्ड, दे स्ट्रगल, and then you put them on a calorie deficit diet and their pain will go away and fatigue will come down. How does it happen? So there is more research which is on this, but I understand from my Ayurvedic colleagues, and we do it for a lot of patients, when we alter their diet by Ayurvedic understanding, we do see good results in those patients. Okay, so low glycemic index grains like jawar have really helped these patients. Now, is orofacial pain a common symptom of fibromyalgia? Yes, 42% to 94% of patients with fibromyalgia are prone to getting temporomandibular joint disorders. So, is it a predisposing factor? Is it whatever way you look at it? The biggest challenge is that जब हमको यहाँ पे पेन होती है, हम एक जनरल डेंटिस्ट के पास जाते हैं. लेकिन आप डेंटिस्ट के पास में जाके अगर स्प्लिंट्स बनाते हैं, तो फाइब्रोमायल्जिया के पेशेंट्स में इससे कोई पेन में आराम नहीं आता है. Fibromyalgia is a central pain syndrome. The pain here is sustained by different mechanisms of the body. Enhanced activity of the sympathetic nervous system, hyperactivity of the hypothalamic pituitary axis, and many other mechanisms are in place to sustain or maintain this pain. Okay, so occlusal splints is not the line of treatment for temporomandibular joint pain in fibromyalgia patients. This is something very important for us to accept and understand. And none of the routine treatment therapies are effective. So what is it that works for their pain? Like what I said in the first part, fibromyalgia pain ke patients, they benefit a lot by small lifestyle modifications, by right kind of activity regime, by mindfulness. So, yes, I was blessed to be a Rutgers student, and in Rutgers, we did get exposed to a lot of guest lecturers. So, Dr. Daniel Claw, who is one of the foremost researchers in the field of fibromyalgia, he had spoken and discussed it at length with us. Then also Dr. Catherine Bushnell had come for a lecture, and she spoke about the role of mindfulness and in the patients of fibromyalgia. If you will look up the work of these people, you will find a lot of information on in connection or continuity to what I am talking today. So these fMRI studies, the functional imaging studies of brain, gave us a lot of data on the pain processing in these patients, and that is how we could establish the effectiveness or efficacy of the mindfulness as a therapy for fibromyalgia patients. The biggest thing is start small. And I am yet to see a patient who did not benefit. It's 10 years of practicing pain independently, and I'm yet to see a patient who did not benefit. The only thing that backfires is when you overdo things. Please do not. You take your own time, listen to your body, and work with it. Mindfulness helps a lot. Yoga helps a lot. Now, what happens when we work with these activities and mindfulness therapies? The parts of the brain, pain has to be processed by body, right? So the parts of the brain which get lighted up in fMRI studies, these parts get modulated, or pain signals get modulated with these therapies, और हमको पेन का एहसास बहुत कम हो जाता है. When we talk about exercise activity or little aerobic activity, that time द मॉड्यूलेशन, मतलब अपनी बॉडी की जो क्षमता है उस पेन को फाइट करने की, वो बढ़ती जाती है वक्त के साथ। तो जब वो बढ़ती जाएगी, जब अपना अपना शरीर ही हमारा साथ देने लगेगा और हमारा शरीर पेन को बेहतर फाइट करने लगेगा, तो पेन अपने आप रिड्यूस होता है। चाहे वो पेन इधर है या इधर है, वो अपने आप रिड्यूस होता है। And then we have cognitive behavior therapies. Then because we have a lot of role of sympathetic nervous system in this, we have also seen patients benefit a lot with therapies like Gestalt, which enhance the awareness of a person. अगर आपकी awareness enhanced है, तो your acceptance is better. If you are able to accept it better, you take more charge of your life. When you take better charge of your life, you are able to steer it. So these are all the things which are connected with the management of pain in fibromyalgia. What else is a symptom in orofacial pain that patients of fibromyalgia come with? Xerostomia, which is the dryness of mouth. अब ड्राई माउथ क्या इतनी बड़ी प्रॉब्लम है? अगर आपको लगता है कि अपने आप से वो बहुत बड़ी प्रॉब्लम नहीं है एंड यू कैन लिव विद इट एंड यू आर फाइटिंग इट, it's not a very good spot, because by this problem you will get more of tooth decay, more of periodontal problems, then difficulty to swallow your food that can come in, and also sometimes there are candidiasis jaisa fungal infections which will come inside the mouth. So please do contact your healthcare provider. वो definitely आपकी मदद करके आपके लिए situation को थोड़ा और comfortable कर सकते हैं. So xerostomia is one condition. Then we have glossopenia. About 40% approximately of the patients may suffer from this kind of a symptom. Glossopenia is the burning sensation of the tongue. We do have a burning mouth syndrome, which is there, which is वो भी dopaminergic system की disturbance से बनता है. Fibromyalgia भी there are studies which are indicating कि genetic pool में serotonergic और dopaminergic system की disturbances से बनता है. तो glossopenia जो है burning होती रहती है, आपको जो उसको भी एड्रेस करने की ज़रूरत होती है. It is a lot of, it's not a very comfortable spot for patients. So these 3 or 4 conditions are the common symptoms, and then there are headaches. Yes. Then there are headaches, which are also there in fibromyalgia patients. About variation, research में बहुत है, 33% to 82% of the patients of fibromyalgia have headache problems. And chronic headaches, approximately 70% of the people with fibromyalgia have it. Now what can be done about it? The same things, the non-pharmacological therapies work the best for nociceptive pain, which is a type of pain that fibromyalgia is. So I very strongly recommend every person who has fibromyalgia, please make yoga a part of your life. Yoga is a therapy. Yoga is a part of your life. Start small, very, very small. Maybe 2 stretches a day, and build it up. And it is a matter of time that you will really be able to live well. Then we have other symptom of dysgeusia, taste alterations. Taste alterations are also seen sometimes in patients of fibromyalgia. Now whatever may be the symptom, the management remains the same. So it is not recommended to undergo a lot of oral treatment like a regular patient, because we have to understand what is sustaining or bringing on these symptoms are the changes with the central nervous system and not the local factors, and then manage that patient accordingly. Okay? So I think with this I've tried to cover most of the aspects which have been put together. most common location of orofacial pain in fibromyalgia patients is the temporomandibular joint disorders. But very frustrated people because no splint has been working, khana mushkil hota hai. See, whenever a problem is there in the upper part of the body, the disability or the frustration is at a very different level, because the functions that get affected are at a very, very different level. So I think with this, we are here ready to conclude our session. The objective was to put the thoughts that are helpful to the community together and contribute in a meaningful way where everyone can live better. We are here for helping everyone who needs better pain management. We are an integrative pain management center. We take into account all the factors, all the presenting things, and customize the treatment plan as per the patients. If anybody needs help, please reach out to us. You can write to us on our email ID, reach out to us on social media handles, wherever. If you have any more questions, you want someone who is suffering with fibromyalgia, you can please reach out to us. If there is something we can do to help you, we definitely will. We do have video consults for people who are living away from the city of Mumbai, and we also offer second opinion services where we can help you manage your condition better with your primary doctor. Okay. Thank you very much to each one of you who have been here today. Thanks a lot.